Well, back to Victoria, where health officials concede that a major coronavirus outbreak in regional Victoria may have been prevented if the state's contact tracing had been improved earlier. And meanwhile, towns along the New South Wales and Victoria border are still confined due to strict rules. It appears that talks between New South Wales about the border reopening have stalled. Joining me now here to talk about it is the Leader of the Nationals in the Senate, Bridget McKenzie. Welcome, Senator McKenzie. Thanks for joining me.
Great to be with you, Cory.
Now, I've got to ask you, you've been a very vocal supporter of regional Victoria. That's where you live. In fact, all the regions everywhere. But in Victoria, you must have seen the pain, the distress that has been caused to some of your constituents, particularly those in those border towns, because they can't cross the river. They can't get access to some of the services and facilities they need because of this intransigence between New South Wales and Victoria.
Yeah, absolutely, Cory. You're dead right. I drove across the border crossing today to head up to Canberra to prepare for estimates. And we've been living with this closure for over 3 months. It's caused untold havoc on kids' education, people being able to access medical specialists, even operating their businesses, because in the community I live in, Albury-Wodonga, we're a community of tens of thousands of people in the immediate geography, but we service over 250,000 Victorian and New South Welshmen in the broader regional context. And so it's caused immense disruption. We've been working through those issues, but as you made reference to in your opening comments, this is simply as a result of the failure of the state Labor government in Victoria to take this virus at all serious manner at the beginning. Our contact tracing systems have not been up to scratch, and even though those failures have been exposed over many months, to still see regional Victoria now being subjected to a cluster of outbreaks as a result of Premier Dan's ring of steel around Melbourne having more holes in it than the very best slice of Swiss cheese, is really emblematic of how this Labor government has rolled out their response to the coronavirus. They haven't taken it seriously. They've ignored medical advice, and they have not implemented an isolated approach to hotspots, which has now seen, again, the virus leaking out into COVID-free regions who've been, in the main, COVID-free for in excess of 7 months.
Senator McKenzie, this has been an extraordinary display of incompetence by the Victorian government. I think people just agree with that. But they've also had a tin ear to some of the concerns of people around the place. And where they've implemented even some minor concessions, they seem to have missed the mark completely. It was raised with me that, you know, a person visiting a regional cafe, for example, has to be quizzed by some junior service person about where they live. They get stroppy about it. People are embarrassed. It's just simply impractical. And yet it's going on, and it's resulted in even more outbreaks. How can you have a double whammy of stupid and incompetent?
Well, when you're a state Labor government run by Daniel Andrews, that's when those two combos come together in, you know, this bizarre and quite catastrophic amalgam. Look, today I went out with a friend who'd come from a regional town down the road, Benalla, and we were asked by our lovely waitress where we came from to produce ID, etc. And again, putting the impost on the business owners who've already borne so much of the cost of this state government's incompetence. I mean, you've even got the World Health Organisation, Cory, saying that we need to treat isolated outbreaks in isolation, swiftly and securely, rather than this carte blanche locking down of citizens and our economic output. I mean, we have a national definition of what a COVID hotspot is. Victoria is under that national definition. It is, according to every other state that's agreed to it, okay to open it up, to get businesses up and running. And yet, this militant Premier recalcitrant and intransigent Premier, refuses to take the advice of even his own modellers that did the modelling that he's basing these decisions on. As you say, flip-flops all over the place, and I think that's been really hard for Victorians to deal with, that the rules keep changing. I think citizens are prepared to do their best, put their best foot forward, put their shoulder to the wheel in terms of any national task, but when they can't make sense of the why, where there is a lack of credible rationale, as we're seeing in Victoria, people are getting very, very angry. And you've seen, you know, Harry was on Bolt earlier, and he's actually a men's shop owner who's been opening up in opposition to the state regulations because it's his livelihood. I think we've got National Cabinet tomorrow, and this is an opportunity for our state premiers to put away their political fear-mongering and really come together as a nation. I mean, we go to war as one country in Australia, and we're fighting a war at the moment when it comes to COVID-19. We don't need 7 different ways to deal with this. We need to come together, and I hope tomorrow is an opportunity for these state-focused premiers to develop a national response and get serious about it, because we're seeing lives and livelihoods impacted.
Senator McKenzie, I suspect National Cabinet has run its course, because now the accountability, it's not just accessing the bottomless pit of money from the Commonwealth, and so the politics comes into play. But can I raise this with you? I've heard you punching away in this space for ages now. I've heard your colleague, your Senate colleague, Sarah Henderson, punching away. I see Josh Frydenberg advocating all the time, unleash the growth in the Victorian economy. I've heard Greg Hunt get into it. I haven't heard one single Labor federal member of Parliament saying, isn't it time to wake Victoria up from its self-induced coma, or Labor-induced coma, I should say.
Well, absolutely, Cory. You've put the responsibility where it is. You know, it's an absolute indictment on Labor MPs. We've got Lisa Chesters, who represents the regional city of Bendigo, Cooree. You can't find her for crickets. Richard Marles down the southwest, representing Corangamite, Catherine King in Ballarat, you know, Rob Mitchell in the seat of McEwen, all having decimated businesses and, alarmingly, an increase in mental health presentations, both at emergency rooms through volunteer services such as Lifeline and SET, jumping up 30% since this pandemic started. So you're seeing a very severe social cost and economic cost in these Labor seats. And you'd think if you're not going to hear it from Albo or Dan or Palaszczuk or McGowan, well, at least you'd think the local members would be standing up for their communities. Yeah. But I guess that's what you get from a Labor MP and Labor state governments.
Well, it's extraordinarily disappointing. I mean, they've put their partisanship ahead of their communities, and that's always a deep concern. But remember, these people, they historically don't care about private enterprise and business, but they've always pretended to say, we care about people's welfare, we care about their mental health, we care about the social services that are available to them. And yet you've raised that important point, and we discussed it briefly yesterday. The data is that consultations of psychiatrists, psychologists, counsellors is up 30%, 300,000 plus in the last 2 months alone. Do these people care nothing for the mental health and well-being of those who are most deeply affected by this coronavirus lockdown?
Well, that's exactly right, Cory, and this is the great tragedy of this virus. I mean, people talk big numbers of support from the federal government financially, big numbers of unemployed and impacted. But at the heart of that are actual families and individuals who are struggling with the very real reality of being socially isolated, of losing their job, losing a business that they've worked their entire life to build as a partnership. And these impacts won't be short-term. Once even the economy recovers, the mental health impact will remain. And I find one of the most concerning stats in that is that it's the presentation of young people to these emergency rooms and online counselling services has increased in excess of 30%. And that's been while they've been away from usual support structures such as their friends and social workers at their local schools. So I think it's quite devastating. It really shows who the Labor Party cares about. And I hope once the crisis itself has finished that Australians and particularly Victorians won't forget who actually stood with them and advocated for them and who actually just let this Premier and his, ship of fools who can't remember who did what when, and we'll actually hold them to account at the ballot box when they next get the opportunity.
Senator Bridget McKenzie, Victoria is lucky to have you, Australia's lucky to have you. So keep up the good work and thanks very much for joining me tonight.
Good to chat, Cory.
Authorised by Bridget McKenzie, National Party of Australia, Wodonga.